think it is important for children to have healthy baby teeth? Why or why not?
Yes, I do think it's very important for children to have baby teeth. Keeping those teeth healthy and instilling behaviors in a child already with their baby teeth is the start to how those behaviors will translate into when it's time for them to lose their baby teeth and for their adult teeth then to start erupting. So developing really good habits when they're younger and getting them into that routine right from the get-go, I think is such an important life skill that they take with them always. And I see that with my kids. And it's also important to have healthy baby teeth because when you don't have healthy baby teeth, then you suffer, right? To me, it's just like it's a cascade of events. If things aren't healthy in the mouth, it affects just everything: social well-being, psychological well-being, and just the physical well-being.
When did you start brushing your children's teeth or started caring for their oral health?
That happened from essentially as soon as they were born. I wasn't using a toothbrush at that point, but I tried as best as I could after every time they ate, taking a clean cloth and wiping their gums. Then when their teeth started to erupt, I started using a soft toothbrush, brushing the teeth, still making sure though that I always wipe the gums. And I introduced toothpaste very early with both of them actually as well. I would say by around 6 to 8 months, in and around there is when they were starting to get their teeth. Already at that point, I was using fluoridated toothpaste, but I was using the very, very slightest smear of toothpaste. And at that point for them, I was only brushing with toothpaste once a day. I think it depends when you introduce the toothpaste. It depends on the behaviors, how at risk the child is of getting cavities. There are certain risk factors that put somebody at higher risk for developing cavities. If, as a dental hygienist, if I had a patient and they were telling me that they are putting their child to bed still with milk or with having a sippy cup and they put juice in it, or just habits that increase someone's chance for cavities, I would recommend starting with toothpaste for sure at that age and for sure twice a day, and continue to do so until like a risk factor maybe changes.
What motivates you to take care of your children's teeth? Do you make it a fun and bonding experience when you do?
I wish I could say that it was a fun bonding experience. If you talk to my kids, they might not say that it is a fun experience. What motivates me is just knowing that what I'm doing is for their own oral health, and it's for their benefit overall long term, that I'm helping them to develop habits that they'll carry on, well past when I'm involved supervising or doing the brushing for them. Because I really think it's important to them that they understand why having healthy teeth is important. That's a really good question. I strongly and very passionately believe that information about children's oral health needs to happen when someone is pregnant. You go to your, regular checkup appointments with the pediatrician. Nobody says anything about the oral health. I think there's certain people that you encounter along the way that could be advocating, I would say, a bit more about the importance of your child's oral health.
Do you think that your personal dental experience affects your child's dental experience?
100%, yes. I think that if I wasn't so passionate about teeth and oral health, absolutely that would have an effect on what happens with their teeth. My husband isn't as passionate about oral health as I am. Not to say that he doesn't brush his teeth, but he probably just wouldn't have been so consistent and so just pursuing it to making sure that it happened, it wasn't forgotten, that it happened twice a day, that it started at a very young age, and that we just kind of continued on from there. With the food choices, making sure that we limit if they have their milk that they have that with their meals, and that beverages in between, that it's always water. We really try to limit to their intake of juice. I try to make sure that they get their fruits and vegetables, whatever, through the things that we eat, not from the beverages that we do drink. A treat for them would be, for if we're talking like about drinks, is that they have like just carbonated water, like flavored, but it's all sugar free. Trying to make sure too that if we brush our teeth and then they want to have a snack, that they know that if they eat the snack, that they have to brush their teeth again, because that has to be the last thing they do before they go to bed. Making sure that we're going for our regular checkup appointments, seeing the dental hygienist, seeing the dentist, so that they get used to that environment. Making sure too, that I have good oral health, because a risk factor for developing cavities is the parent being one of the ones with cavities. So making sure that I'm demonstrating good behaviors and being a role model in that way too. The first thing I would tell them is that cavities are it's a preventable disease. It doesn't have to happen. There's a myth out there that I think that cavities are just one of those things that everybody gets. No, not everybody gets cavities, and you actually can prevent your child from getting cavities. It's just a matter of making sure that what you're doing, your preventative behaviors, are outweighing what the risk factors are. And some of those preventative behaviors, I would say, make sure that you're brushing your child's teeth using a fluoridated toothpaste, making sure that you are controlling the amount of toothpaste that they do use, making sure that you're doing the brushing for them when they have little ones, that they're not old enough at 2, 3, 4, 5 to be brushing their teeth on their own, that you have to do it for them, to do it twice a day. That yes, your child will probably be resistant to those behaviors, but just to keep doing it. I will for sure continue to stress the importance of oral health and taking care of your teeth with my kids. Hopefully help them too to understand that the effort is worth the outcome. Final tips, just don't give up.
Thank you so much.
You're welcome.